Early on in their 20s, there are different issues you want to look at. What are you doing for exercise? Some people are not exercising at all, and they just think they're young and their metabolism is fast. They haven't gained weight, but it's not necessarily a good sustainable approach. I can eat anything, but you really need to ask them. What are you eating? What's your diet like? How much fast food? We always screen with cholesterol, early on, because younger people can have a really high cholesterol, and that can give them a heart attack really when they're 30. I've had a couple of patients that had heart attacks at 30 from a cholesterol that was high, really from their late teens. With a blood test in your 20s, we screen for diabetes, we screen for kidney problems and cholesterol issues, and then we screen for diet and exercise. And then a lot of younger men are taking supplements, but some of those supplements may not necessarily be healthy. It may adversely affect your kidneys. It may have hormones that people think, testosterone, which is a men's hormone, that it can't be anything but good, right? But testosterone in wrong doses can make you infertile. People don't know that the supplements that they're taking that may, just in order to look good, may have an adverse effect on their health. And so earlier on in their 20s, we're really thinking about what you're doing, what are you taking, what risks are you taking, what's your job like. As you get into your 40s, it becomes more preventative, more cardiovascular, related to cancer. What's your blood pressure, how much salt do you intake, again, what's red meat, how much of that are you eating, what exercise are you getting. That usually cuts down in the 40s, and that's when people's metabolism slows and people start to gain. At 45, we start checking a PSA every year, which is a prostate-specific antigen, which allows you to screen for prostate cancer. That's when your first colonoscopy is probably recommended, or at least some form of screen for colon cancer should start at 45. If you have a 25-pack year smoking history, so 25-pack years is smoking a pack a day for 25 years, then you need to be screened for lung cancer. We're able to screen that and find stuff early, because the key with prevention is to find it early. If you find a cancer early, it's more apt to be cured than find a cancer late. A lot of men, unfortunately, say, if something's wrong with me, I don't want to know, right? And so a different approach is saying, if something's wrong with me, I want to know early, so the treatment is less, severe, and so the cure is much more apt to be achieved. And so it's important to screening for these things early and regularly. We're going to be deliberate at the Cutler Center to tracking when you need what. Really make sure that we're getting your labs done, you're seeing your primary care doctor, you're getting all the screenings that you need, because prevention, not reactive treatment, but prevention is the key.